to ask all of our panelists today, so reflecting on these excellent presentations, we're homing in on one element of the report, that school health and nutrition programmes promote inclusion and equity, with a warning that more must be done to reach those who are missing out. So I'm going to ask each of our panel members if they would like to turn on their cameras again, and I will go back in the order of the original presentation. So I'll go to Mr. Castle first. What do you think is a strategy, something that decision makers could do now to make a difference for a group of students who are missing out? So I just go to Mr. Castle first.
Well, thanks very much once again, Professor Gray, for a really excellent webinar. It's been fantastic presentations and a great discussion and dialogue on a really important topic. With regards to the question, one thing that I've heard come up a number of times, and I keep hearing over and over again, is again this issue of mental health as an area of well-being that really urgently needs much more attention and focus. So I think as we're moving forward in the process of supporting holistic, comprehensive, integrated school health and nutrition programs, let's not forget that we really do have an alarming situation with regards to young people's mental health and well-being that requires that we all think about how we can respond to that better. I know that some of the partners in the interagency group, particularly UNICEF, have really invested and shown quite a lot of leadership when it comes to mental health issues and what we can do through school health programs around that. And so I guess for me, that's a cross-cutting issue, regardless of whether you're rich or poor, urban or rural, whatever your situation is. I really think it's long overdue that we get more serious about addressing mental health of children and young people. Thanks very much.
Thank you, superb. Professor Ma, what would you think?
Thank you again for the invitation, and thank you, Professor Bundy, for your interest in my presentation as well. Thank you. And to ensure school health services to benefit all learners, decision making should have robust system and mechanism in place to identify who are missing out on these services. This required proactive effort to gather data through regular health screening on marginalized groups, such as left-hand children in China, children of migrant workers left behind at hometown, and monitoring and evaluation school health program. And decision makers must also ensure that sufficient resources are allocated to meet the unmet health need of this group. In China, left behind children are one such group that need urgent attention. They often lack access to essential health services due to their rural location and the social disadvantage. In particular, the lack of mental health and psychological support in absence of their parents make it crucial to implement targeted interventions that address their specific health needs. And thank you. This is my thinking.
Thank you. Okay, excellent perspectives coming out here, and lots of children potentially missing out. Dr. Olumide, what would you like to add?
All right, thank you very much, Dr. Gray. I would say that it's important that our government reaches out to out-of-school children, because even though as much as they are hoping that the school, we try and find out what is then keeping them out of school, so they can bridge that gap and ensure that they come into school and also enjoy business. Otherwise, we are failing them.
Thank you for that. There was a slight wobble with the sound, but it was very much about those who are out of school, students, making sure that students have every opportunity to get into school and take advantage of the meals and the services. I summarised that appropriately. Professor Bundy, what would you like to add?
So I think one of the things that really attracts all of us to this area of work is the extraordinary scale at which we're able to operate, that countries are able to operate. This is 400 million children being fed every day, and more than 90% of them getting health interventions as well. So let's not minimize the huge value of what's going on. But at the same time, of course, there's, as the School Meals Coalition has recognized, there are 73 million children who are amongst the most vulnerable, who are not being reached. So we've got to do, we can't deny it. We have to do both of those things. We have to keep going at scale, but we also have to take care of those who are most vulnerable and who are missing out. That would be my answer.